Hi.
Hi, my name is Melise Marston, and I'm a financial counselor with Intermountain Healthcare. I understand you have some questions now that you've had your treatment.
Yes, I do, Melise. These terms are so confusing to me. Do you know what effective date means?
Yes, I'm happy to help. The effective date is the date the insurance started. It mostly coincides with the calendar year.
I've heard a lot about pre-existing conditions, and now that I've had cancer, do I need to concern myself with anything?
A pre-existing condition is any health condition that existed before your policy was purchased, usually placed to anything you've seen a doctor for in the last 6 months. Some insurance policies have a 6 to 12 month waiting period after the effective date. That means the policy won't cover expenses related to pre-existing conditions. Cancer is a condition that could be considered pre-existing, so it's a good idea to ask about it before you switch coverage. The Affordable Care Act has prohibited insurance companies from denying medical coverage based on pre-existing conditions. However, some plans have been grandfathered in and still have pre-existing condition clauses.
What is that certificate of creditable coverage all about?
The certificate of creditable coverage is a letter your insurance company will give you that shows you have an active policy with them. If coverage between your previous insurance and the new insurance is continuous with no gaps for 62 days or less, a pre-existing condition will not apply.
If I switch insurances and I don't have a gap in coverage, they can't charge me for a pre-existing condition, can they?
That's right, they can't deny coverage for that condition.
I get so confused about the differences between copay, coinsurance, co-deductible. What's the difference in those?
A deductible is the dollar amount you pay before the insurance benefit begins. This amount varies from nothing to up to thousands of dollars. Sometimes well visits require meeting the deductible first. A copayment is the amount you pay directly to the service provider, such as a doctor or hospital. Most patients have inpatient and outpatient copayments. Coinsurance is the portion of the bill that is responsible to pay. For example, if your coverage is an 80-20, your insurance pays 80% of the allowable amount and you would pay 20%.
What's the out-of-pocket maximum?
The out-of-pocket max is the cap or limit per calendar year that you will pay out of your own pocket before the insurance pays full coverage. The calendar year is when the insurance company starts the benefit period again. Most start in January, but some companies such as school districts and public employees start in other months.
What does the notification mean?
Notification is basically telling the insurance company that you're being admitted to the hospital. Many times this takes place within 24 hours of an admission, and sometimes this is provided by the hospital.
What if my insurance asks for a pre-authorization?
Some procedures require approval by the insurance company before you have the procedure done. This is prior authorization, and you can typically call the insurance company to inform them of the procedure.
If I've had any kind of procedure that the insurance company's denied, is there a way that I can get them to pay for that?
Yes, you can also appeal a decision. Ask your insurance company about their appeal process. Sometimes there will be time limits on when an appeal can be sent. It is a good idea to involve your doctor if you are appealing an insurance decision.
Now, the insurance company said that the procedure was on their exclusion of benefits. Can you tell me what that is, please?
Exclusion of benefits is a list of procedures or treatments that the insurance company has decided they will not cover.
When I get my statement, Melise, there's a column that says allowable charges and charges. What's the difference between those two?
An allowable charge is a predetermined amount an insurance company will pay for a service. It is often lower than the charges amount.
What's the difference between that in and out of network?
In-network is a list of physicians, hospitals, and health agencies that the insurance company prefers you use for health services. They typically have established relationships with these providers. When you choose an in-network provider, both the insurance company and the provider agree that the charges above the allowable amount will be adjusted off the bill. This means you don't have to pay for the difference. An out-of-network provider does not have the same relationship with the insurance company and are not on the preferred providers list. If you go to an out-of-network provider, you might have to pay the difference between the billed and allowable amount. This is called balance billing. Some insurance companies don't have any out-of-network benefits, which means all charges will be your responsibility.
I get so many things in the mail after I've seen a doctor. What is the difference between those and how much do I have to pay, really?
The first thing you typically get in the mail is an explanation of benefits, or EOB. This shows a breakdown of insurance benefits by listing total charges, discount amount, if applicable, what the insurance paid, and how much is your responsibility. However, this is not a bill. If any services are denied, it will give the description for why the service was not paid for. After you get the OB, you will get a final bill. This will clearly state that it is a bill. It will show the charges amount, the amount the insurance paid, and the amount due. You will also get an itemized statement. This is not a bill, but a listing of everything you received. For example, a statement for a surgery shows the OR use time, scalpels, medications administered, and all other care received. It's a good idea to look over all these statements very carefully. The amounts listed should match across all statements. If they don't, you should contact your insurance company. If you have any questions, you can call customer service at your insurance company. They will be happy to help you. Did this help answer your questions?
Thank you so much for your time. I've really appreciated this help.